Stand by, Marion. We're having a technical difficulty.
From unceded and unsurrendered Algonquin territory and from the Crow's Nest, the First Nations Health Managers Association brings you another edition of the virtual town halls with respect to COVID-19 information updates and credible information. I'm Marion Crow. I have the pleasure of being the Chief Executive Officer of FNHMA, and we want to make sure that we get information that's timely out to everybody who's listening, who's watching us now. We're super excited to have a spectacular lineup for this hour of information sharing. I do want to just say a special thank you to indigenoushealthtoday.ca. So that's ihtoday.ca. Stella, Dawn, Chris, we are so excited to be partnering with you to make this happen. In terms of what our format looks like, I want to hear from you. You can send us questions to our inbox. So when you hear these presentations and see them on your screen and hear them out on those radio stations, please send questions to FNHMA at ihtoday.ca, and we'll do our best to get those up in the last 15 minutes of our hour together. So again, that's FNHMA at ihtoday.ca. Joining us today for our return, we have a number of exciting information participants. So in terms of what our agenda looks like, hey, I just want to say, Marika Nadeau, thank you for joining us. We also have Sam Burton joining us. And of course, I would be remiss to forget Adrian Lee as well. These are our partners at Health Canada and Canadian Digital Services, who the COVID-19 alert app. I also want to say that we will have Dr. Evan Adams from Indigenous Services Canada, and we're going to close out with Mary Deliri from our partners at Thunderbird Partnership Foundation. I'll be giving a little bit more information as we go through our time together, but let's get us started right away. Dr. Evan Adams is with First Nations and Inuit Health Branch, Indigenous Services Canada. And Evan, you're going to provide an update for all of our listeners and viewers on what's happening from a national perspective. Dr. Adams, thanks for coming back and joining us once again. Over to you.
Good morning, everyone, or at least it's morning here in Pla'amin Territory, where I am a member and where I live on the coast of British Columbia. And I wish I had better news, because we had such extraordinary numbers in August. In August, we had the lowest number of cases ever since the pandemic was declared. We only had 20 active cases amongst First Nations on reserve in the entire country. That has begun to change. And what we're saying is that the second wave is around the corner, and there has been an upswing in the number of COVID cases across the country, and including amongst many of our communities. So just a reminder that the total number of COVID cases in the country is at about close to 150,000 now, with about 128,000 of those have recovered. So that's still some extraordinary news and a good reminder to us that many of us will have only mild disease, but that doesn't mean that there aren't some sad outcomes for others. We're almost at 10,000 deaths in Canada. So just to give you a very, very quick summary of what's been occurring with us since August the 15th, we've had quite an increase in the number of new and active COVID cases compared to the week of August 23rd to 29th. Our new cases have gone up 6 times, and the number of active cases have gone up 5 times. And I encourage you to go to our website at First Nations and Inuit Health Branch. If you Google Epi Update FNIB, or Epi Update FNIHB, our Epi page will come up. It's called the Epidemiological Summary of COVID-19 Cases in First Nations communities. So that's where our data is kept. So this increasing number of new cases in the general population and in our population is concerning. There are currently over 100 active cases in the country, and about 50 in hospitals, and we've recorded 9 deaths since beginning of March. The main active areas where we're seeing cases are in BC, Alberta, and Manitoba. Since last week, there have been several cases in Manitoba reserves where we've not seen any. So before last week, we hadn't seen any on reserve Manitoba cases. And there is some activity in, of course, other provinces and territories as well. I'll just take a moment to say, and this, I'm not telling tales out of school, there was a cluster of cases in my home community where I live and my parents live, and my sisters and brother live, just under 30 cases, but it seems to be quieting down. And I just wanted to leave you with that idea as I finish my short presentation, is that the vast majority of communities, of our communities that have had COVID-19 have settled them fairly quickly, but there have been some exceptions. Some communities seem to keep having ongoing transmission, and so that's of concern to us. And so those communities have been receiving help. We were talking today about other communities that haven't felt the first wave, but we do expect that more of our communities will receive COVID diagnoses, and there'll be clusters, small or big. And we've been told that all of them, of course, have been getting ready, and I encourage all of them and all citizens to be prepared if that should occur. And last of all, to be prepared, not scared. That's it for me. And I'm going to be on the line if there are any questions about anything that I put forward today. Thanks.
Thank you so much, Dr. Adams. I love that. Be prepared, not scared. And if you need support getting prepared, check out the FNHMA resources. We do have a pandemic planning tool that's free. It's on our website at www.fnhma.ca. And if you find that resource helpful, send it along to other communities who might need support with their planning as well. So really appreciate the message, Dr. Adams. For those of us who were watching on ihtoday.ca, we are back. We are live. And if you're wondering why I am wearing an orange t-shirt when it is not Orange T-shirt Day, I'm doing my due diligence and reminding everybody to go get an orange t-shirt for next week. Every child matters. Wear your t-shirt next Wednesday in support of recognizing all of the residential schools that are a part of Canada's history. So go get your orange shirt. I do want to just do a quick acknowledgement that while we were on break over the summer, we had a number of losses in leadership. Specifically, though, I want to thank the Atlantic region for having given Canada Sally Johnson, the health director, who brought so much to improving and bettering our health services delivery in Indigenous communities. So, Sally Johnson, you are remembered, and I hope you are with the Creator watching down, knowing that you left a legacy. So, thank you, Sally Johnson, for all of the hard work, and may you rest peacefully with the Creator. A reminder to everybody that if you do have a question for us, that email address to send your question in is fnhma@ihtoday.ca. So we'll be checking that inbox shortly. The other thing, just as we transition to our other guests, is I want you to set a calendar date right now. Everybody, make sure you're writing down that on November the 4th, celebrate with us, celebrate with the First Nations health managers, and let's thank loudly on that day from 1 p.m. to 4 p.m. Eastern on this very platform, ihtoday.ca. We will be thanking all health workers who are working so tirelessly right now to keep our nation safe. So November 4th, celebrate with us. If you would like to join in the celebration, take a look at the FNHMA website. There are sponsorship opportunities available for that day. And if you have an inspiring message that you want to share to thank your health worker, send us a quick 30-second video. We've got 3 hours of airtime to thank our front lines. We're very excited about that. Now, as we get into the presentations, I'd just like to thank again Health Canada for joining us and Canadian Digital Services to talk about the COVID-19 Alert app. I am going to download that app while Mary chats a little bit later. So Marika, I'm going to call on you now to walk us through what we need to know about the COVID Alert app and why it's important for our nations to use it to continue staying safe. Marika?
Perfect. Thank you, Marianne, and thank you to the association for welcoming us and allowing us to discuss with you today. So the intent here is really to give you an overview of the application and in the hopes of creating awareness for yourselves and also for your loved ones and friends and family about downloading the application and as well as using it should you be in need. And I have my colleagues from Canadian Digital Services who will also give a demo of the application, so that will be great. And then also talking about how we can further enhance the application or ensure it meets the needs of all users. So COVID Alert is a national application that was launched in July 31st. It's a tool, it's one of the tools that can definitely help slow the spread of infection, prevent future outbreaks, while even though we're sort of in the wave 2, and protect our communities. And if you've listened to Prime Minister Trudeau's speech of the throne yesterday or his address to the nation last night, he definitely raised awareness on the COVID Alert application and has requested that as much Canadian download and use the application to help notify others that have been tested positive. So key things to remember, and I'm on slide 2 of our deck that should be on the tracing where you are. It's tracing who you've been in contact with and then notifying these people that you may have tested positive. The application was built with privacy first, so definitely strong measures to protect any data that is collected collected. And as I mentioned, it does not track your location or does not collect personal identification. We have strong support by the Privacy Commissioner of Canada, who was consulted on the app, and that supports its use by Canadian. As we launch provinces and territories to the app, we also get the blessing from the province Privacy Commissioner on the privacy-related aspect of the app, so that all the checks are marked on that aspect. Going on slide 3 of the deck, how it works, and Sam will definitely show you a bit how the application itself works when you have it, but it uses Bluetooth to exchange random codes with nearby phones. So when you go out and you're near people, there's mechanism behind the scene, you're working with Bluetooth that creates random codes. And then if you test positive, your public health authority will be issuing you a one-time key that you enter in the application. And then once you enter your one-time key, information is secure. They don't know who you are, but they will. The other phones that were near you, 2 meters, 15-minute random codes, get notification that they potentially were exposed to somebody with COVID-19, and then they should follow the public health guidance on what to do next. I'm on slide 4. It's a bit technological, but it just shows you that the app there's a national server store that does the random codes. The platform for use is Apple and Google notification framework. And then the codes are used through the public health, either public health province web portal or their local web portal. And then that's how they are able to issue one-time keys for those that test positive in order to be able to notify other users. I'm at slide 5 right now. Definitely touched on earlier in my presentation about the privacy and security. So definitely was designed to safeguard the privacy of the information. So we're not collecting your professional data. We're just collecting random codes from your phone through Bluetooth and being able to share. So it's not we don't know where you are, we don't know where you ate, but we can definitely try and notify those that were close to your phone at that time. Currently, while it's a national application, and definitely encourage all Canadians to download the application, the one-time keys that I was talking about, so those that go and get tested and get positive and get one-time key to enter their notification. We have 4 provinces that have onboarded. So Ontario was the first one when we launched in July. There's Newfoundland and Labrador, New Brunswick, and Saskatchewan. We're actively working with the other provinces, and stay tuned because I think we're going to have other provinces coming in on board sooner than expected, or sooner than later for sure. Right now, we have 2.7 million Canadians that have downloaded the application, but definitely as much people that download the application makes it better for people to get the notification. So if you're in, I'm in Quebec City, I'm in Quebec and get snow, but if I go on Ontario and somebody I was close to get tested positive and enters a one-time key, I would be getting a notification even though that I'm in the province of Quebec. So it's can benefit for everybody. I was on slide 6, sorry. We've created some useful information and digital toolkits with posters and social media, promotional hashtags, as well as for Twitter, LinkedIn, and website that we're going to share with the association for you to use. We've just launched a poster that can be printed or sent to members or users, or to increase awareness. So that will be provided to this association for distribution. I'm on slide 7. And definitely a partnership, and I think it's a good segue to have Sam, our colleague at the Canadian Digital Service, to potentially start the demo and show you how the application actually works from a user perspective. So thank you very much, and I think we'll be taking questions after our entire presentation. Thank you, Marianne.
Well, thank you so much, Marika. And as mentioned, we will be taking questions. Please send those in. A reminder of that email address again is fnhma@ihtoday.ca. So, Sam Burton, I know you are excited to share some more information with us. So I'm passing it over to you, and then Adrian Lee, you'll follow up right after. So thank you, ladies.
Great. Thanks so much, Marianne. Thanks so much, Marika. Hi, everybody. My name is Sam Burton, and I'm a Senior Policy Advisor at the Canadian Digital Service, where I'm part of the team working on Canada's National COVID-19 Exposure Notification Service, which Marika just introduced you to. We really appreciate the invitation to join you here today. Thank you so much for having us. So what I'm going to do now is give you a preview of the COVID Alert app, which is now available for download in the Apple Store and Google Play Store. I'll be using a demo version, so it's a little different from the one that you'll see if you download it directly, but that's basically just to give you a sense of what could happen in all the various scenarios. So I'm just going to turn off my camera and then share my phone screen. I could just get a thumbs up from my colleagues on video if you can see the screen. Okay, perfect. I also know that some of you are listening to this on the radio, so you won't be able to see the screens that I'm about to show. I'm sorry, this demo, it might be a little tough to follow without the visuals, but I'm going to do my best to describe what you'll be seeing. So the first thing I'm going to do is take you through what it's like to experience the first time use of the app. So imagine you just downloaded the app from the App Store and it's here. You can see my phone. The icon is next to the settings and I haven't opened it yet. So let's click the icon and open the app for the first time. So when the app opens for the first time, you have a greeting screen with the name of the app, and then you're invited to choose whether you'd like to use it in English or French. So I'm going to choose English for our demo today. On this next screen, it's the beginning of an introduction to the app. So you'll only see this next series of screens the very first time that you open up the app. The first screen says, "Together, let's stop the spread of COVID-19." And below that, it says, "COVID Alert helps us break the cycle of infection. The app can let people know of possible exposures before any symptoms appear. That way we can take care of ourselves and protect our communities." When you click next, the next screen says your privacy is protected. So as Marika said, this is really fundamental to the way that we design the app, and we want to make that really clear to users from the very beginning when you download the app on your phone. We also know that it can be a barrier to using the app, a lack of trust or privacy concerns. So again, we want to make this information clear really up front. So what this screen says is your privacy is protected. COVID Alert does not use GPS or track your location. It has no way of knowing your location, your name or address, your phone's contacts, your health information, or the health information of anyone you're near. So that's just a list right up front to let folks know that that's how the app works. The next screen describes how the app works from a more technical angle. So people naturally have a lot of questions about this. Marika shared some of this in her presentation. And so this is how the app just provides a quick overview about how it works right from the start. So this screen says the app uses Bluetooth to exchange random codes with nearby phones. Every day it checks a list of random codes from people who tell the app that they tested positive. And if you've had close contact with one of those people in the past 14 days, you'll get a notification. If you scroll down, you'll see that there's also a link to learn more about how it works and more about the technical side of how the app works. I'm not going to click that right now because we'll go into this a little bit more in detail later, but if you download the app yourself, you can go and have a look at that when you're doing the onboarding intro. So when I click next, the next screen says one part of public health. So we really wanted to reiterate here that the app is just one part of the overall public health effort to reduce the spread of COVID-19. So that's what the screen says. It also says, encourages users to follow all public health guidelines in your area, and says that COVID Alert does not replace medical advice. So if you get sick, contact your doctor or other healthcare provider. We want to be super clear that that's still necessary if people feel ill. So going to the next screen, this one says that the app will now ask your permission. So the application at the screen, when you click next, will ask for your permission to start listening for those random codes from phones that are near you. So we describe on the screen exactly what's being asked for so that it's really clear what you're agreeing to. And again, this is because we know the biggest barriers to uptake are privacy concerns and comprehension. So we really want to help people feel as confident as possible that you have the full information as you're downloading the app. If you scroll down a little bit on this page, there's a link that says learn more about privacy. So I'll click that here just to show. This takes you to the privacy policy, which provides more information about how your privacy is protected in the app. There's a lot of text here, which people who are watching can see. So I'm not going to actually read this, but it goes into a lot more detail about how the app protects your information, what is shared and what is stored, and importantly, what isn't as well. So I'm just going to close that and click next. So now you can see that there is a notification that pops up here. It's a dialog box that basically asks us to enable our phone's ability to collect and share random codes using Bluetooth. So this pop-up is actually a system level notification. I'm on an iPhone, so it's one that Apple designed. If you're on an Android device, it'll be one designed by Android. We don't control the content of this notification, but we've gotten some feedback about it. So we're also working with Apple and Google to help make sure that this is clear to users. So basically from here, you're going to click enable to make sure that the app has access to begin logging with Bluetooth. Just a heads up, because as I mentioned earlier, I'm using a demo version of the app. There's a weird bug that's going to happen right now that's going to take me to the beginning of that introduction. That won't happen when you're on the real app. So just pretend like that doesn't happen when I scroll back through to get to this screen. Okay, so click enable. Okay, pretend you can't see this. None of this happened. All right, and then you click enable. This is where you'll end up on the screen that's asking, where do you live? And so in this step, you're being asked to choose the province or territory in which you are located. And there's a couple of reasons why the app is asking for this information, which stays only on your phone. So this isn't sent anywhere. First of all, not all provinces or territories, as Marika mentioned earlier, are set up to distribute the one-time keys to people who test positive for COVID-19. And so that's necessary for the app to function fully. So we want to provide guidance to users based on whether or not that's something that's available to you in the province or territory that you're in. Secondly, when you receive an exposure notification, that comes with public health guidance, which you'll see a little bit later in this presentation, that's specific to the province or territory that you select here. So that's another reason why it's important to make this choice. There is, of course, also an option where you can prefer not to say if you would rather choose that. But I'm currently in Ontario, so I'm going to select that and click done. And then here you get another system level notification. So the system notification little pop-up comes up and it says, COVID alert would like to send you notifications. So basically this is just a standard type of notification you're probably already familiar with if you use them on your phone. It's the kind of notification you might get if you get a text message or if there's a weather alert. So you're basically giving the app permission to send those to you. And I want to enable this because I would like to see one of those notifications if there's the potential that I've been exposed to COVID. So I'm going to allow notifications. And then we're all set. That's it. That's all you have to do to get the app up and running on your phone. You see the screen that says you're all set. It means that COVID alert is active and the phone's now running Bluetooth to collect codes from any nearby phones. There's nothing else that you need to do from here. You close the app, carry on with your life. The app runs in the background and you don't have to do anything once it's set up. Basically, once this is set up, if you and your phone spend more than a few minutes near someone else in their phone and you both have the app, the phones exchange random codes. As you go about your day, your phone keeps collecting those random codes from other phones, and it doesn't send them anywhere. They're just on your phone. And those random codes also can't be linked to a specific person or device. And then once a day, your phone downloads from the national server random codes from anyone who is recorded testing positive for COVID-19. So if any of those that your phone downloads match a phone that you've been near in the last 14 days, that's when you get a notification letting you know that you might have been near someone, you might have been exposed to COVID-19. So I'll show you what that looks like in a minute. But from a user's perspective, there's nothing else to do once you've set this up, unless you receive a notification or are diagnosed positive for COVID-19. One other thing I'll show you before I show you those scenarios is what it looks like for people in provinces and territories that aren't fully onboarded yet. So if I click the menu, which is at the bottom, it gives me this kind of long menu where I can change some of my settings. And what I'm going to do here is change it to a province that isn't onboarded yet. So change province or territory, and I'll change to Quebec. And so you can see once I close the menu, there's now a screen that says there's no reporting yet in your area. So basically, we want to encourage people, like Marika said, to turn the app on even if your province or territory isn't fully onboarded. And Marika gave that great example of living in regions bordering each other, like Ottawa and Gatineau. So if a person in Gatineau has the app enabled, even if Quebec isn't onboarded yet, they'll still get a notification if they're potentially exposed by someone from Ottawa who's using the app. And I'll also just give a quick preview, seeing as how I chose Quebec, what the app looks like in French. Oops. There you go. So now you can see that it's in French, so the app is fully bilingual in French and English as well. Okay, so I'm just going to flip back, press the menu, change back to English, change back to Ontario. And now I'm just going to show you two last things that will be helpful to see. Oh, one other thing is, so you're all set. This screen is what is shown right after you turn the app on for the first time. After day 2, you'll start seeing another screen which says no exposure detected. So after the first day, this is the screen that you will see, which just said no exposure detected if you happen to open the app and just want to check and see where you're at. So next, I'm going to quickly show you what happens if you have been diagnosed as having COVID-19. So if you're in a province or territory that's onboarded, when you receive your positive test result, you'll also receive from your province's healthcare authority a one-time key, which is an 8-digit alphanumeric code. So entering that one-time key into the app lets your phone notify people you've been close to in the last 2 weeks that they might have been exposed to COVID-19. So let me show you what this looks like. When you click the menu at the bottom, there's this a blue button that says enter your one-time key. So I'm going to click that. And the screen that comes up takes you through the 3 steps that are coming next. It says, let people know they've been exposed. Step 1 is enter your one-time key that you got when you were diagnosed. Step 2 is agree that COVID alert can let people know they were exposed. Step 3 is allow your phone to share your random codes. And at the bottom, it says nobody will ever get any information about you or the time that you were near them. So we want to be really clear about that, make sure people know what's going to happen before they proceed. So then after reading this, you can click next. And here you see a screen where it says enter your one-time key. For the demo, I generated my own one-time keys just for demonstration purposes. But as I said, in real life, what you'll actually do is receive a one-time key from your healthcare provider. So I have my one-time key. I'm just going to enter it. And then the screen it takes me to says, now you can upload your codes. So there we go. You're being prompted to upload your codes for the last 14 days. It reminds us that no one will get any information about me or any time that I was near them. And also says, if we agree, we can help slow the spread of COVID-19. So I'm going to agree. And when I click that, this is another Apple system level dialog. Like I said, that's because I'm on an iPhone. If you're on an Android, it'll look a little bit different, but basically the same idea. And here you have to agree at the operating system level that you're okay with sharing these IDs. So like I said, we don't control this content, but the idea is the same. So click share. And then it takes you to this screen. So this will now be, if you have been diagnosed, this will be the home screen that you get when you open the app for the next 13 days. It says, thanks for helping to fight COVID-19. Reminds you that for the next 13 days, you'll get a daily notification asking for permission to upload any random codes your phone sent out. And then you're also reminded that agreeing to send these codes is optional. And it just stays like this for the next 13 days. And then once that is clear, it goes back to that very first screen we said where it's green, just saying that everything is active. So the last thing I'm going to show you is what it looks like if you get an exposure notification. So that's basically if you get a notification that you've been near someone who's been diagnosed positive. So this is another demo trick. You won't be able to do this on the app, but just to give you a flavor for what happens. So basically, here's a So there's an example of a notification. So it says you've been exposed, you've had close contact with someone who reported a COVID-19 diagnosis. It's just a little pop-up, which will look super similar to any other notification that you get. Clicking on the notification will bring you back to the app. And when you go back to the app, this is the screen that you'll see. It says you've been exposed in the last 14 days. Someone you've been near has reported a COVID-19 diagnosis through the app. You were close to them for 15 minutes and more. And of course, this can be quite a scary thing to get. So we want to make sure that folks know exactly what to do next. And that's the big button right below, find out what to do next. And what you get when you click that find out what to do next button depends on which province or territory you selected earlier. So I'll click on it here just to show you. And I get taken to the Ontario page around what to do because that's the province that I selected. And that's it. So that's basically all of the different things that you might see when using the app. As Marika said, anyone can download the app right now, and Ontario, Newfoundland and Labrador, New Brunswick and Saskatchewan are the provinces that are currently on board where you would get a one-time key to enter if you test positive for COVID-19. And we're continuing to work with the other provinces and territory to get them on board as soon as possible. So thanks so much for listening. I'm going to pause and see, I don't know, Marian, if any questions came through so we can take any of those if so, or I'll hand it off to Adrienne to do the final part of our presentation. Thanks so much, everyone.
Thanks, Sam. And Adrienne, I'm just going to do a time check. I'm going to make you speed through some of your presentation. No questions have come into the inbox yet. So Adrienne Lee, over to you.
Yeah, no problem. And I hope Sam's walkthrough of the presentation was helpful. So I'm just going to get set up here. Okay, and a thumbs up if you can see my screen for my, yeah, okay, great. So hi folks, my name is Adrienne Lee, and like Sam, I work at the Canadian Digital Service, or CDS for short, and we're one of the partners that built this app. And we're a team within the federal government, and our work is about improving government services, making them more accessible and inclusive. So a lot of my colleagues have worked on the app, but we know that the app is not perfect. There are issues like older phones not being able to download, and you know, people have misunderstandings about how privacy is protected on the app. So while the app is kind of a best effort from our team to stop the spread of COVID-19, we don't think it's perfect and want to make it work for more people. So that's why I'm here presenting to you today to learn if the app is something you'd like to use and if you'd like to help improve it for you and others. And here are a few questions that we're interested in answering. And if you have the answers right now, you can write your responses to the town hall email inbox that Marianne mentioned, or follow up directly with me. I have a slide near the end with my contact information. But mostly these questions are just to give you an idea of the questions we're asking to improve the app. So first is, would you be interested in using this app? Why or why not? Broadly speaking, is this app accessible to you? Why or why not? And lastly, would you be interested in improving the app for you and others? So on that last question, in terms of improving the app, here's an example to give you an idea of a process that CDS uses to improve the app. So on an ongoing basis, we host one-on-one sessions with people who use COVID Alert, and then ask them to show us how they use the app, questions they have, and what's confusing for them. In one of these sessions recently, we learned that the screen people see when they receive an exposure notification, one of the screens that Sam just walks us through, provided details that caught their attention and then caused them confusion. So in a few weeks' time, the designers and developers on the team worked to simplify the screen, while still keeping the main purpose, which is to let them know about the exposure and then to direct them to next steps. So the team worked on improving this issue as well as a number of others. And then they put out a new version so that it's available for download. So we gather feedback, we make changes, we gather more feedback on those changes, and then it's kind of a cycle of those 2 steps. And we're working to reduce confusion and increase access from the start, even before we get that first round of feedback. But like any team, we have our biases, and we know for a fact that reaching out to more people and hearing from them will make the app more usable and useful for them. So if you're interested in improving the app with us, here are a few examples of how. And I've kind of broken them down into the 2 steps of that cycle I described earlier. So gathering feedback and making changes on the app. So in terms of gathering feedback, it could be that CDS gathers feedback from you and others, as we do right now. Or maybe you'd like to get more involved and you'd like to gather the feedback in your own communities. And then CDS helps with that process if that's preferred or needed. And then in terms of making changes to the app according to the feedback, CDS can make changes to the app as we do right now using the skill sets we have on the team. Or again, maybe you'd like to be more involved and you'd like to be part of the process to make changes to the app and bring your skill sets and perspectives to the team. So there are kind of different levels of involvement, and it kind of depends on what your preference is.
Adrian,
So
here we go. This is how we
I'm
get
almost
in
done.
touch with you.
Yeah, so if you have any questions or answers to those questions I proposed earlier, this is my email on the screen. We'll also follow up with my email address, so it's easy to find. And then if you want to sign up to share your feedback, this is a link on the slide here. It's a quick survey, you give us some information, and then we contact you to sign up for a session later on. So thank you very much for your time.
Thank you so much for the presentations today on the COVID-19 Alert app. I do want to remind everybody, if you do want to engage further, please get in touch with Adrian directly. This information will be up on ihtoday.ca. I also want to let you know that you can also identify any suggestions that you may have to us at fnhma@ihtoday.ca. So use that inbox number to give us some feedback. And before we lose any more time, I'm going to cut that one short and I'm going over to Mary. Mary, I'm making up time, other places in the agenda, so you have your full 10 minutes. Mary Dellery, Thunderbird Partnership Foundation, thanks for being with us. And you're about to share an update on training and education with us and all of our viewers and listeners. So a big welcome to Mary.
Miigwech, thank you so much, Marianne. Yes, and I really appreciate the opportunity provided by FNMHA today to share about some training updates from Thunderbird Partnership Foundation. I am going to begin sharing my screen. I do have a PowerPoint presentation, and I will make every attempt to be descriptive of the slides, knowing that we do have some radio listeners and people who are on the phone. So I will begin with just a very brief introduction of myself. Algonquin, Anishinaabe, and Dao. Gedigan Zibi and Dunda Dizid. So greetings. My English name is Mary Dellery. I just introduced myself with my spirit name and my clan, and I am Algonquin Anishinaabe from Gedigan Zibi. I am currently coming to you through this webinar from my home on Oneida First Nation in southwestern Ontario. We are enjoying some beautiful weather. So I am going to move on, and I am going to move on to slide 2. I am the Training and Education Manager for Thunderbird Partnership Foundation. I just want to give a brief overview of Thunderbird Partnership Foundation. For those again who are listening and are not able to view. So the Thunderbird Partnership Foundation is Canada's leading culturally centered voice on First Nations mental wellness, substance use, and addictions. The organization supports an integrated and holistic approach to healing and wellness, serving First Nations and various levels of government through research, training, education, policy, and partnerships and communications. Thunderbird strives to support culture-based outcomes of hope, belonging, meaning, and purpose for First Nations individuals, families, and communities. Our mandate flows from honoring our strengths, a renewed framework to address substance use amongst First Nations, and the First Nations Mental Wellness Continuum framework. So I'm moving on to
Thanks,
slide
Mary.
2.
Can you speak up just a tiny bit for
Oh,
our
okay.
audience? Thank you, Mary.
Oh, thank you for saying that. Yeah, I'm not even conscious of my voice. So is this better?
You got it.
Okay, thank you, Marian, for the cue. So Thunderbird Partnership Foundation, we have, over the past 5 years, been offering a platform of training courses accredited through professional certification bodies, and our practice has been to offer face-to-face delivery of training. In response to COVID, Thunderbird Partnership Foundation has adapted to virtual training. So all of our courses are now adapted to virtual delivery that we are offering to all of our stakeholders. I just want to give a brief overview of the training courses that we offer and are now offering virtually. We offer First Nations Mental Wellness Continuum Framework implementation training. We offer care facilitation, emotional intelligence, training using trauma-informed approaches in our work, an early intervention training that is called Buffalo Riders. We offer also a pharmacology training course. We offer a strength-based care training. We offer a culture as foundation and native wellness assessment. And also, in order to meet the needs of our stakeholders across Canada and the regions, we also now have a platform of Train the Trainer courses to expand capacity into the regions. And those Train the Trainer courses, we have a Let's Talk Cannabis course that is again focused on youth intervention. The Buffalo Riders is also in Train the Trainer, is a Train the Trainer model. We have a Land for Healing, Train the Trainer, and a Community Crisis Planning for Prevention, Response, and Recovery, Train the Trainer course. These courses vary in length from 2 days to 5 days. The 5 days are the Train the Trainer courses. Also, we do have online courses for self-directed learning currently, and so you can access those courses through the Thunderbird website, www.thunderbirdpf.org. If you're interested in signing up for self-directed learning, there are 4 courses: indicators to assess cultural competency, intake, referral, discharge, and aftercare planning, a prescription drug abuse, and clinical supervision. And these online courses also are certified through professional certification bodies. I am now moving to slide. I'm sorry, I stopped providing the slide numbers. So this slide that I am on is actually, it is a graphic, and it is a visual of our virtual platforms. So that at Thunderbird, we developed a community of practice virtual platform to support our training programs. And as COVID, as we began to experience all of the challenges of COVID and the new environment that we are now faced with, and having to move virtually, we created and developed the community of practice platform to meet the needs of COVID as well. So on our community of practice, there are a number of hubs. We have 2 hubs that are dedicated to First Nation treatment centers, and those hubs are to provide a virtual platform for treatment centers who are working to develop a national virtual online treatment program. And so there is a adult treatment center hub and a youth treatment center hub. We also have a community wellness hub, and I will provide more description to that hub in the next slide. The Community Wellness Hub was a direct response to COVID-19 to provide a forum and a virtual platform for frontline workers, First Nations frontline workers across the nation. We also have we have designated training hubs for each of the training courses that I outlined, that each training hub is available for enrollment by all participants that have taken that designated training course, and is again a network. It is facilitating the network. It is providing continued support and resources, and is also a platform where we will support ongoing professional development for all of our training participants. We also have a training hub that is dedicated to our train the trainers, so that again they are moving through a train the trainer journey with supports and resources as they offer the training regionally. So it is a very large platform, and it is continuing to grow. And again, I'm going to move to the next slide, and this next slide describes more, gives more description to our Community Wellness Hub. The Community Wellness Hub, as I said, was a direct response to COVID-19. And we wanted to provide access through this community of practice to community wellness workers, First Nations workers, people who work in treatment, people who are part of mental wellness teams, healthcare workers, again, to provide access to Thunderbird Partnership Foundation specific resources in relation to wellness. Also that Indigenous wellness specific resources, also, non-Indigenous clinical specific resources that can provide supports in the work that is being done in First Nations, and importantly, to provide a forum for our valued community workers to support one another in providing service. And knowing that in navigating these challenging times, that for our First Nations community workers, it is so important to have a forum to share strategies, best practices, successes, as well as the challenges that we are faced in attempting to navigate this current landscape. So the Community Wellness Hub provides a space to share strengths and resources through open conversation and dialogue, and it includes reflection on our cultural teachings, our traditional teachings and practices, our Indigenous ways of knowing, our ways of being, and sharing those experiences even of our personal, of the personal journeys and challenges that we are experiencing in this very different time. And we are encouraging participation on the community of practice. And if you are wondering or would like to access the Community Wellness Hub and share and participate with all of the other frontline workers who are currently enrolled. We currently have, I think, about 350 individuals that are participating on the Community Wellness Hub. And if you are interested, you can contact us at training@thunderbirdpf.org. And also, if you're interested in any of our training, the virtual training platforms that we are currently offering, you can utilize that same email to contact us. If you are interested in the self-directed online courses, you can also connect with us at training@thunderbirdpf.org, or you can also contact us through the Thunderbird website. So a few options of reaching out to us, and we will definitely respond. So I'm finishing the presentation that way. Say miigwech to you, and just wishing everyone wellness, continued wellness through this time. Looking after our well-being, the well-being of our families and our communities. That is our most important priority in this time. So sending my thoughts out across the country, sending my thoughts of wellness to all of you, and miigwech Marion, for the opportunity. Thank you.
Thank you so much, Mary. I listen to anyone from Thunderbird Partnership Foundation speak, and it's always with passion, commitment, and dedication. And I'm so supportive. We'll have all of this information up on the website, both at ihtoday.ca and also on the FNHMA website as well, so that everybody can get the information that they need to. So thank you very much again. I do want to say that we had Jessie comment on Facebook saying, "Oh my goodness, I've been looking for the Thunderbird Partnership Foundation information, and now she's heard it, she's seen it." So again, if you're interested in any of those courses that Mary was just referring to, I highly encourage you to get online and do the self-directed, or get in touch with them directly to talk about what your journey is going to be. In terms of questions from the inbox, it has been a quiet inbox. Dr. Adams, I will give you a heads up that somebody is looking for your thoughts, and I think I'll come back to this next week. But Dr. Adams, what are your thoughts on culturally safe contact tracing? So something for you to ponder. We haven't had any questions about the COVID app yet either. So we have been super informative today when the inbox is quiet. So a reminder, please go to FNHMA at ihtoday.ca. Get your questions in. We'll continue to monitor that inbox. We can still respond to your questions after this broadcast. And if you're looking to participate further in terms of the feedback sessions, please get in touch with our partners that have presented today, and also let us know through the inbox email. If you have questions about COVID-19, there are supports for you. Info Point at FNHMA is a program that we started at FNHMA to find you the information you need. If you are too busy to look for information, let us do the digging for you. You can reach out to Info Point at info.point@fnhma.ca. Send them an email. We'll get back to you within 30 minutes with information tailored to your question, or give us a call. You can call somebody at Info Point at 1-855-446-2719. I do want to share with you, I don't know if you can see this because I have a privacy screen, but that's my mama. And that is my COVID-19 alert app that I just downloaded while we were having the presentation. So thank you so much to everyone who presented. I do want to say a really big thank you to a whole bunch of people who are live streaming this on Facebook. Micmac Maliseed Native News, The Wolf 95.7, Nation News, Element FM, NCIF. Thanks for the chat this morning. streaming live on air. Alberta Native News, CJWE, CFWE, CKLB, Co-op Radio, APTN News, FNHMA Facebook, and to those radio stations, NCI. Hey, NCI, the Wolf 95.7, KCLB will rebroadcast this as well. And a big hi. Stay safe, stay well, and tune in next week, same time, 1 p.m. Eastern, here on ihtoday.ca. Take care.